involves using what we call a micro cannula, so it's like a blunt-ended tube rather than anything sharp going anywhere near your eye. We make a small insertion point near the top of your cheek, very painless, and then the rest of the procedure is just with that cannula, and that slides through just under the eye area here in a really safe plane with no sort of pain fibre, so it shouldn't hurt you at all. It feels uncomfortably comfortable. It takes about less than a minute under each eye, and we just place the filler in the appropriate plane near the bone, and then it's out and you see the results pretty much immediately. So the treatment is a very low pain treatment. It's a very quick treatment as well. The whole procedure takes less than 10 minutes, less than 5 under each eye. The only bit that people find a little bit uncomfortable is we're making the slight entry point with the needle here and here, but it literally lasts for like a second and then that bit's all over. And most people don't even feel that. The rest of the treatment, that's done with a micro cannula because it's blunt tipped and we put it in a layer of the skin that has virtually no pain fibres. You really don't feel a thing. So there's a number of different things that can happen under the eye as we get older. Sometimes people get bags. The actual excess skin isn't suitable for treatment. So it's really important that if you have any concerns or issues under your eye and you're considering treatment, to get a really appropriate assessment done. Some people get under eye tear troughs here, quite deep grooves, really early because it's a genetic issue too. So even from your early 20s, sometimes people can have quite deep grooves. So it's not always related to age, it can be a genetic factor too. So the treatment itself is really quite quick. We always give appropriate time to discuss every bit of the treatment with you, from your suitability, the treatment itself, and aftercare. So that actually takes up the bulk of your appointment. The treatment itself doesn't take very long at all. We've done thousands, so it's a treatment that we're well versed in. So it takes, I would say, under each eye, maximum, less than a few minutes. So you pretty much see the results straight away, but what you've got to imagine is that there is a bit of swelling there, so it's going to go down slightly. But because of the way this area is anatomically, and the composition of this area and the composition of the filler, it will draw a little bit of water to the area, which will make the area more hydrated. So overall, your result will be at the 2-week mark. Sometimes it can be at the 3 to 4 week mark, depending on your swelling, but most commonly 2 weeks. So this is a very, very common question that we get asked all the time, and the clear answer to that is absolutely no. So the filler here is made up of hyaluronic acid, which our body recognises as its own. So when that is placed into the layer of the skin that we place it just on top of the bone, it actually sits there and integrates very well with your own body's soft tissues. And it also stimulates collagen in the region. So most people, from experience, what we've seen is that the tear trough never really goes all the way back to being as deep as it was. In fact, it actually always keeps it improved. The worst case scenario would be that it would go back to how it was when it wears off, but it will never be in a worse state. Also, the fillers that we use specifically in our clinic is Tear Density 2, which is one of the only licensed ones for use in this region, and it has 14 added ingredients to really help rejuvenate the skin in the region and also to brighten up the colour of the skin too.